Hello everyone, I am Dr. Murali Manohar Chirumamilla and I am a consultant Ayurvedic physician. In this video, I am going to talk about bow legs and knock knees and what you can do about this. Bow legs and knock knees are relatively common in infants and children but are usually no cause for concern. You need not worry about this. They are stages that children pass through, and it is important to remember that most legs are perfectly straight by the teenage years. Now, let me explain you about bow legs. It is called genu varum in medical terms. Bow legs means legs that curve outwards at the knee, and it is called bandy legs. Bow legs are very common up to the age of 3 years. In fact, they are quite normal up to the age of 2 or 3. This means that when the ankles are touching, the knees are apart. The bend in the legs often causes the child to walk pigeon-toed with the feet pointing inwards. Bow legs usually correct themselves when the child starts walking, so much so that from about the age of 4, there is a tendency for the child to develop knock knees. Braces or special shoes do not help to straighten any better than natural development. Okay, then how can you check the progress? If you are concerned about the extent of the bow legs, the problem can be monitored by measuring the distance between the knees. DBK, distance between knees. If this is greater than 6 centimeters and not improving at 4 years and older, it is advisable to have them checked by your physician. Comparing progress can also be helped by taking serial photographs every 6 months. Okay, then I will explain you about knock knees. Knock knees means it is a condition in which the legs curve inwards so that the feet are apart when the knees are touching. Knock knees are also normal in children and most have these between the ages of 3 and 8 years. Running can be awkward but improves with age. The rule for normal 3-year-olds is 50% have 3 to 5 centimeters between the ankles, that is DBA. 25% have more than 5 centimeters. These invariably straighten nicely after 8 years. Then, how can you check the progress? For any concerns about the degree of knock knees, measure the distance between the ankles, that is DBA, distance between ankles. It should be checked by your doctor if the DBA is greater than 8 centimeters after the age of 8 years and not improving. Keeping a photographic record is also helpful. In nutshell, in summary, it is normal for the children to have bow legs between 0 to 3 years and knock knees between 3 to 8 years and legs straight by adolescence. Okay, now let me throw some light on the causes. Physiological genu varum is the most fundamental thing. Vast majority of babies have a genetic condition that is normal and is not associated with any pathology. This is other than the fact that some babies may appear bowed legs during their infancy and early childhood years. Boys are 3 times more likely to have genu varum as compared to females. Next important cause, vitamin D deficiency. Rickets or chronic deficiency of vitamin D can also lead to bowed legs in young children. The worldwide prevalence of vitamin D deficiency is high in countries where sunlight exposure is low. However, babies who consume high calcium and vitamin D foods are usually at much lower risk of developing rickets. The incidence of vitamin D deficiency rickets is fairly high in developing countries like our India. Next important cause, Blount's disease. Abnormal bone growth in babies at the level of tibia can also lead to bowed legs. In toddlers and during childhood, bracing can often help in correcting the Blount's disease. In teens or adults, panchakarma is often needed for optimal restoration of normal architecture. And other less common causes of bowed legs in children are osteogenesis imperfecta, tibia vera, achondroplasia, tumors, bone infections, inherited skeletal defects, an early childhood fracture that healed imperfectly. Now, let me talk about diet and nutrition, especially pertaining to these bow legs and knock knees. Intake of healthy and nutritious diet reduces the risk of developing bone issues, skeletal deformities, and recurring episodes of inflammation that further disintegrates the joint cartilage. Calcium, vitamin D supplements, mineral supplements, and other proteins and vitamins are essential for normal development of these children. It is often advised to consult a Ayurvedic physician to deliver quality nutrients without increasing the risk of weight gain in these children. Next, use of proper shoes is also important. Certain corrective shoes can be effectively used for early management of foot and leg disorders. For example, if parents employ shoes with certain features like reverse lace, wedges, torque heels, straight lace, in the same way scaphoid pads and shoe lifts, the risk of leg and foot deformities and mold deformities can be reduced significantly. However, such interventions should only be taken after a detailed discussion with your Ayurveda physician. Next, about the active or passive exercises. Depending upon the cause and pathogenesis of children with bowed legs, doctors may advise different lifestyle modifications and or corrective exercises to manage bowing in children. For example, doctors may advise delaying the walking in children in case of early onset bowing or may advise to limit the walking on both feet. In the same way, leg straightening exercises are extremely helpful. These exercises decrease the pressure, stress, and strain on your muscles and soft tissues around knees and legs. Then, how to do it? Lie flat on your stomach on an exercise bench. Bend your knees in flexion and slowly touch your buttocks with your heels. Repeat this exercise after fully extending your legs. Once you get used to this exercise, you can also use weights on your feet. And in the same way, yoga is also helpful. Yoga is a holistic method of managing bow legs. It allows muscles and soft connective tissues of the body to realign with the anatomical architecture of the muscles and bones. In addition, it indirectly improves core body strength and restore healthy posture that is often altered in children with bowed legs. Then how to do it? Lie on your back ideally on a flat surface such as ground. Slowly lift your legs in the air and hold as long as possible. In the same way, lie on yoga mat and align your legs together. Lift both legs in the air while legs both align. Hold your pelvis also while supporting the upper torso with upper limbs. And another important thing, reassurance. Oftentimes, when bowed legs begin to interfere with physical activities or day to day life functions, children develop mood swings, agitation, complex, or depression. In all such cases, it is duty of parents to reassure the children via counseling to prevent mental issues, and this is called Aswasana in Ayurveda. And the most important thing, maintenance of normal body weight. Bowed legs suggest that the bones and associated connective tissue are under more stress and pressure due to poor angulation or unequal distribution and alignment of joints. Therefore, parents should prevent weight gain in children by promoting healthy eating habits, limiting junk food intake, and promoting normal physical activities. It is also observed that obese babies are at much higher risk of developing aggressive joint damage in setting of bow legs. The risk is even higher if bone or skeletal disorders run in families and in situations when the child is short statured. Okay, this is all about bow legs and knock knees. There are certain medicines also in Ayurveda like Pravada Pishti, Pravada Panchamrit. These medicines are to be prescribed basing on the pulse diagnosis and basing on the body type and basing on other associated conditions. In the same way, we will know about some important aspect or topic in the next program. Satam Jiva, Sarado Vardhamanaha, Satam Hemantan, Satam Vasantan. This is all about the bow legs and knock knees. Take care and bye bye.